I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. Please do subscribe my channel and press the bell icon button. Then you will receive all my recent videos or latest videos, which are usually, we talk on different infectious diseases or other health problems. Let's talk about the tetanus. Tetanus, no doubt, is very rare in the Western world nowadays because of the vaccine, because of the awareness of the disease, better management, better wound cleaning. That's why. But we see a lot of cases of tetanus in the underdeveloped world. Tetanus is caused by a bacteria, which is spore-forming bacteria called as Clostridium tetani. It enters into the body through the wounds or broken skin, especially wounds which are contaminated, because this bacteria is found in the soil, dust, and manure. Whenever the wounds are contaminated with dirt or feces or spit, then this bacteria enters into the body. Any punctured wound which is contaminated with any soil or anything like that, or needle. Burn wounds are also an important source of the tetanus. Crush injuries, injuries with dead tissues. There are some other ways of entry of the Clostridium tetani into our body. For example, clean superficial wounds, surgical procedures, surgical wounds, or insect bites, dental infections, compound fractures, or when the bone is broken and bone is exposed through the skin, chronic sores and infections, or sometimes there are also reports of intramuscular injections. People who are specifically at risk of tetanus, intravenous drug users, or who work in the fields, or whoever, for example, they are not vaccinated, or their immune system is weak, or they have received vaccination a long time ago. So time from exposure to this bacteria and the illness. So this is also called as an incubation period. So actually it's a time from exposure to the illness is usually between 3 to 21 days, but average 10 days. In most of the cases, the sign and symptoms appear around 14 days. But this incubation period could be as early as 1 day or as late as several months. But if wound is a contaminated wound, then the incubation period is usually less. And if the disease is severe, then the prognosis is usually worse. What are the signs and symptoms? There is one very important sign of the tetanus. Many people even call tetanus as a lockjaw, because one of the most important or common sign of this infection is the tightening of the jaw muscles. Tetanus infection, no doubt, can lead into the serious health problems, including being unable to open the mouth and having trouble in swallowing as well as in breathing. So other symptoms include sudden involuntary muscle tightening, often in the stomach, painful muscle stiffness all over the body, trouble in swallowing, jerking or stirring, severe headache, fever, sweating, changes in the blood pressure. So the complications of tetanus are always very serious if it is not treated appropriately in a timely fashion. Then uncontrolled involuntary tightening of the vocal cords, broken bones, so bones are sometimes broken, infection. Whenever patient is admitted into the hospital, then hospital acquired infections, blockage of the artery of the lung, artery blockage, and then the blood clot, blood clot travels somewhere else into the body, a severe pneumonia or lung infection, breathing problems as I mentioned earlier, and possibly leading into the death. So the death rate is quite high. So 1 to 2 in 10 cases are always fatal. So how this Clostridium tetani is diagnosed? So usually it is diagnosed on the basis of clinical sign and symptoms of this, because the sign and symptoms are typical. So even a doctor who has never seen this case before in his or her career, but once they see the tetanus patient, so they can recognize very quickly, and also the history is always suggestive of this infection. So there are some other tests to check the inflammatory markers, or if there is another infection, for example, if patient is in the hospital, so then the other tests are done. But there are no specific tests for Clostridium for the tetanus infection. So how it is treated? So of course, hospitalization is very important. Patient should be taken into the hospital, and treatment should be started immediately. Immunoglobulins, tetanus immunoglobulins are very important. So tetanus immunoglobulin should be administered. Aggressive wound care like a debridement, so removal of the dead tissues, and also give drugs to control the muscle spasm. Antibiotics are very important. So the antibiotics are given not only to kill the microorganism, but also the toxins which are released by this organism. So some antibiotics neutralizes the toxins. So now we talk about the prevention, because prevention is very important. So in prevention, vaccination, or if immunoglobulins are needed, then should be given, and wound care is very important. So wound should be cleaned properly, aggressively if there are dead tissues. So then dead tissues should be removed, and vaccination should be according to the local guidelines. For example, in United Kingdom, there is a green book which is very helpful. In United States of America, so CDC guidelines are very helpful. So immune status of that person is very important in the prevention of tetanus. Thank you very much for watching this video.